And today, if you take your browser to supertalktv.com, you will find out more from Dr. Marshall about COVID long-term, or long-term COVID, which however we can define the term. He's an allergy and immunologist, big word, and he's doing research at the University of Mississippi on the long-term effects of COVID. There's no other way to say it, is there, Dr. Marshall?
That's pretty well summarizes it.
Well summarizes it. But this isn't, and I know we were just talking about the COVID fatigue. Folks are so tired of hearing about it. So we're not talking about that part of it. But we hope to maybe shed some light on, the signs, symptoms, and then the research you're doing for those who may be experiencing more long-term effects of the COVID virus. So where do we begin? First, defining it. How do you define, Dr. Marshall, long-term COVID?
So, Rebecca, I think your comment about COVID fatigue is so relevant because so many people that I've talked to, patients and friends at church and other things, they hear the word COVID and you can just watch their minds go click. Yep. I don't want to hear about it anymore. And I get it. I really do. I feel that way as well. I live with it 7 days a week, and I feel that way as well. I really understand the point. But let's put it in perspective. COVID started out as if we can vaguely remember back in the early 2020, and we heard about this group of people in China, and they kind of came up with this name, and nobody really thought about it that much. But it was a viral illness that was not unlike severe flu was 100 years ago. In the United States, right around the time of World War I, there was a world pandemic. And essentially the difference, what a pandemic means, is that you have symptoms that essentially go global all at one time. We are in that situation now because we live in a global society. It's not hard to get on an airplane right now, and by this time tomorrow, be standing halfway around the world. Thousands of people do that every day. So if this had been probably 100 years ago and that outbreak in China started, it would have never even gotten to the capital of China, as crowded as that country is, let alone all the way around the world. Because we are, as human beings, had not seen that virus before, we didn't have any kind of natural immunity against it. So it just basically ran through the population. And it took out people that were substantially ill. That was expected. Older individuals, people with certain chronic diseases like diabetes and cancer and heart disease, people that had had organs transplants so their immune system were suppressed, those were people that were not unexpected to have severe disease with this. What was surprising was how many otherwise normal people, 30s, 40s, 50s, with no known underlying problem, got sick, ended up having this horrible disease, and some of them died. But even with that's what we heard on the news every night. The overwhelming majority of people that got COVID were people that got, like a bad cold or like a case of the flu. And they got well and they went about their lives. Mm-hmm. That usually happened in 1 to 3 weeks, like you would have if you had the flu. Most people of our listeners have had some version of the flu or a bad cold that lasted a week or so.
And then your life got back to normal.
Yeah, and you felt bad for a little while, but over the next few days to a week, you were back to normal. What we now know in COVID is that there is a portion of individuals that get acute COVID, not only from the sick ones that end up in the ICU on a ventilator and they're fortunate enough to survive and then they have to go through rehab and so on, but the ones I just described. I'm sick and I don't feel good. I expect I'll be better in a week or two, and they just never get better. They continue to have, if they got a bad cough, they continue to have the cough. If they get short of breath, they continue to be short of breath. And very concerning and happening very commonly in this group of individuals is that they get that kind of brain fog. Imagine, again, you're sick with the flu for a couple of days, and you can't really think straight. You don't want to do anything deep. You want to be left alone because you feel so bad. They just never get over that.
But does the fever sort of subside to sort of the major symptoms?
Commonly, that's exactly right.
So it's just like a linger hangover?
Right. It's like a COVID hangover. That's exactly right. And they never quite get well. Well, they began to gather the information because we were seeing this in our clinics, the different kinds of, I see an awful lot of asthma in my clinic. So I was seeing asthma patients that before the pandemic were doing fine, and all of a sudden they weren't doing fine anymore. My cardiology colleagues were seeing heart patients that way. My hepatology colleagues were seeing liver, and the nephrologists seeing kidney, and so on and so forth. We were seeing all this stuff, and it didn't quite make sense. And then as people around the country and around the world began to put their heads together, they realized that there was a component of individuals that were not just getting well. So they had a long version of COVID, which is where the term long COVID came from. And then we developed a fancy 25-cent word for it called PASC, P-A-S-C, which stands for post-acute sequelae of COVID. And there were not people that were actively dying of that, but the morbidity, the illness that was created was substantial. The most conservative numbers you see now in the U.S. from that is 10 to 20%. The more progressive numbers are as much as 50%, and this depends really probably on where you're talking about, what part of the country.
With the individuals, because I have a few friends who suffered from COVID, they don't talk about the breathing problems longer, but they still have not gotten back their smell or their taste completely.
Right.
And, they've learned to do life without, necessarily without it, but they'll still bring it up in conversation. Is that part of it as well?
Yes.
Even though it's not like keeping you from living a healthy and, everyday life?
Well, there's a difference between your heart beating and your lungs working and a quality of life that you have. And just imagine, we talk about all the different tastes we have realistically, where there are only 5 tastes, but we have hundreds, if not thousands, of flavors, which is a combination of taste and smell put together. Okay, and that's how we perceive it. Imagine that all you can taste is something that's sort of sweet, sort of sour, sort of bitter, sort of salty, or sort of savory, and you have nothing else. You have 5 tastes. Your quality of life will go out the window really quick. Right. Just think of a bad cold.
Right.
One of the reasons you're not hungry is if food doesn't taste good.
Right. Exactly. Okay, so now I'm thinking I've got 2 people I know that definitely would fall into this category. And like good researchers do, you guys try to figure it out. And so that's exactly what I guess some of you at UMMC are trying to do. How did you get into the study of long COVID?
Well, I was, as an immunologist, when I also function in our clinical research operation at UMMC. And we had just opened in November before this all started. We had just opened a brand new clinical research center up on the top floor of the main hospital. And we're looking for projects. And oh, my Lord, we had no idea what we were getting into, but this got dropped in our laps. And we were able to start up clinical trials. We started up the first ones in Mississippi back in April of 2020. And from that, people, because of our population and the diversity of our population, rural versus urban, minority versus white, well-to-do versus not so well-to-do, and all those different combinations, Mississippi is a very coveted place to understand the role of these various components in diversity in clinical illness. We have things like the Jackson Heart Study that studies that in cardiovascular disease. So they came to us and wanted to know what's going on where COVID is concerned. The NIH was involved in this as well, the National Institutes of Health, and when the emergence of long COVID became apparent, we were one of the groups through our affiliation with the NIH. We were one of the groups that were asked to participate, and we, of course, jumped at the opportunity to do so for the benefit ultimately of our citizens and then by extension the citizens in other parts of the country.
So how do you even begin researching it? Because still, it's 2022, so we're still 2 years out. When you say long COVID, it's still only a baby illness that we've known about, in relative terms. But when you think of someone getting well in 1 to 2 weeks, and then you look at now it's going 2 years. That's definitely a long-term linger. It's a long hangover.
Right, a real long hangover.
That's a really long hangover.
That's exactly right.
So how do you even start to study that?
Well, the interesting thing is you have to start with the definition. What do you do for PASC or long COVID? And like most things in medicine, the things that go on are really a continuous variable. It's a spectrum. It goes from A to Z. And what we have to do sometimes artificially is make a cut point. So in the initial definition of PASC, long COVID, we decided people that had symptoms associated with their acute illness that lasted for longer than 30 days. Because in the majority of the individuals, it had resolved by the end of 3 weeks. So they added another week to it. In Europe, they're even more liberal in that they make them continue for 120 days. And I will just say parenthetically, that whole concept is being actively discussed and debated among investigators around the country. This is a national group that we're recruiting 19,000 patients for in 60-some-odd centers around the country. Our group, we're trying to recruit 100 just here in the local area. So you see that there's a lot of them glued together. So, but with that definition, now you can say, okay, so you had PASC. It caused you to lose your smell and your taste.
We're going to pause there, Dr. Marshall. We're keeping you. We're going to dive more into long COVID coming up next.
Okay.
We're finding out more about long COVID today with Dr. Marshall. He's with the University of Mississippi Medical Center, or UMMC, and they have been charged to help with the research to find out why some people develop long COVID, why some don't, and all the ins and outs of that. So don't turn off your dial just because we're saying COVID. We're not talking about any of this, but you may actually fit this bill, and they're needing people for their research, and you want answers if you have some of these long-term symptoms from it. Or, as we were talking, Dr. Marshall, you may not even realize that you're suffering from long COVID, because there's many of us who went through the pandemic and, we just didn't get tested or didn't feel like we needed to, or whatever it may be. So we don't know if we ever had it. But as you're describing some of these symptoms, we're like, man, that's been plaguing me for a while, and you could still fit the bill. So my question to that is, if you aren't sure that you ever had COVID or not COVID, and I come to you and say, I feel like I've had this sort of brain fog, shortness of breath, or no taste or smell, which you should have went to the doctor if you couldn't taste or smell, but that's neither here nor there. Can you tell if someone had it and then just was never diagnosed with it?
We can get a pretty good idea of that. There are blood tests that we do, and indeed, one of the things in our study is we're looking for negative people that have never had COVID to control against. Because the question we're asking is that, or at least the first question we're asking is that, what was it that made you? There are three people just like you. All three got COVID. You didn't get any symptoms after a month; they were gone. The person next to you got symptoms, and they lasted for about 4 months and then finally went away. And the person on the other side got symptoms, and 2 years later, they're still there. Why? And that yet you're all in the same age category, you're the same gender, you're the same race, you live in the same type of environment. What's different? And so if we can't come up with some social differences, which we're quite interested in, then we go to the next level. Or what about clinical differences? Do you not have any other illnesses, and one person had diabetes, another person had asthma? Maybe that's not the case. Maybe your diet is different than their diet was. You eat a more pro-inflammatory diet and somebody else doesn't. Maybe you take certain kinds of medicines and somebody else doesn't. Or maybe the interesting thing is that you just sort of say, well, I don't need to go to the doctor. We don't like to go to doctors, and I get that. I mean, I am a doctor, and I don't like to go to the doctors. So, and you just sort of, you get used to it. When things happen chronically in small increments, our brain will just dismiss it and move on. And so we see people with really significant illnesses, not even necessarily related to COVID, and you ask them, how are you doing today? Well, I'm okay. Because they're asking themselves how they're doing today compared to yesterday.
That's even in hypertension and diabetes.
Absolutely. It's in all chronic diseases, and that's the point. So the disease can get much, 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 much worse over a period of time. We're seeing the same thing in these long COVID patients. And so what's happening is that unless you ask them the question, are you having any trouble, just thinking? Well, no, of course I don't have any trouble thinking. Well, let me ask you a question. What about fatigue? Well, I'm tired all the time. I'm getting older, this and that and the other. But you say, compared to a year ago, can you sit and watch a TV show that's not particularly interesting, or will you fall asleep? If you sit still in a quiet room, will you fall asleep? Do you have trouble smelling good stuff when you walk in for dinner? Can you tell if something really smells good or smells bad, or do you just kind of sit down and shovel it in because that's what you do?
Right.
You begin to ask those questions, and I'm amazed the number of people in that, both patients and research participants. It's like a light turns on their eyes. They say, well, you're right. So one of the things, if somebody wonders about this, if they were to, say, enroll in our study, and there are other options, of course, but if they enroll in our study, we might determine they could enroll as a negative control. I've never, to the best of my knowledge, ever have COVID, and I'm fine. And we might find, and we're finding somewhere as much as 10 to 12% of the people enrolling, they didn't know they had COVID, but they did. And then when you query them, maybe they don't have any more symptoms. So they had it acute and they got over it, and that's fine. We're still interested in those individuals because what helped them get over it that somebody else couldn't. So you ask both ways. What's wrong with the individual? And I put that word wrong in quotes, but
Right.
what's going on with the individual who has it? And what about the person who doesn't have it? What kept them from getting sick in the first place? What kept them from getting long sick if they got sick in the first place? So we're interested in all spectrum of individuals, and there are candidly very few people that we would turn down if they had an interest in the study because of our desire to understand the differences between people that either stayed well, got well, versus those that didn't.
What are the requirements? Obviously, you've mentioned the requirements, Dr. Marshall, to get into the study, but what are the requirements of the study if you're interested?
So the only real big thing is they need to be 18 years of old or older because this is an adult cohort. There are pediatric cohorts around the country, but we're not one of those sites. The individual essentially is seen and evaluated. We do a bunch of physical exams, and they answer a variety of questions and questionnaires. And then they come back at intervals depending on what's been asked of them. Some of them will ask more of, some will ask less of. They come back at 3 months, then they come back at 6 months. So they come back several times over a year. Then they come back annually for 3 more years. So they're actually in the study for 4 years. Now, it's like any other study. A person has the right to stop whenever they want to stop. They can say, I don't want to participate anymore, and that can be done. It can be explained to them, and they can say, really, I don't want to get involved in this. I don't have the time now. I'm not interested, and so on. We try very hard to get people in as quickly as we can, again, as diverse as we can. But I work with a really talented group of nurse coordinators, and there is zero pressure put on the individual that has an interest. Somebody can call and say, well, let me tell you about it, and the nurse gives the 10-minute spiel. And then they say, nah, I'll have to think about it. Well, you're not going to – this is not like the robocalls that you get. You're not going to get 6 calls in the next 6 days saying, have you decided? Have you decided? We want volunteers because there's an investment of time and effort. There is compensation. There's financial compensation for being involved in this study that goes along, and that can be explained to them at the time that they get more information. That it's not enough to pay for their time. That's not what human research is for, but it does compensate and acknowledge the fact it takes time and effort, and there's expenses associated with it, and there's enough to cover that for the individual.
And two, just the fact that you can be a part, especially if you have the long-term symptoms, even though, you may not get the relief that you want now, you will be part of the studies that could help provide better therapeutic options for the next wave or the next wave. And this is how we squash it so life gets to, sort of go on is you better understand the invader that was COVID. Mike from Ridgeland said, I'm 63, Dr. Marshall, and I've never had COVID. He's been tested as well. I feel like he's one that you would love to.
We absolutely would love to have Mike to be involved in the study. And the reason for that, again, is that he's not old. I'm 71. He's not old, but he's not young either. And we need that spectrum of individuals to be able to compare to. Is there something about Mike that kept him from getting COVID? Is it something that somebody else is different that made them more likely to get COVID? It's hard to do that without a comparison. I compare that to the idea of people saying, I want to paint my wall white. Don't go to the box store and try to get white. You'll get 37 different varieties of white, each of which has a name. So we have to have that negative standard to be able to look at. So folks like Mike would be very welcome.
Carl says, is insomnia part of long COVID? I've never had insomnia until after I had COVID.
Well, by definition, it would fit the criteria that we're talking about for long COVID. A new symptom, and was it coincidence or is it cause and effect? That's part of the research question. We don't know. But to allow someone like him to enroll in the study would be very important because here's a new symptom that came up in association with his acute illness, and I'm assuming from what you're telling me is persistent. That would make him a candidate as a long COVID individual.
What if someone like Mike from Ridgeland, who has never had COVID, starts the study, Dr. Marshall, and it's a 3-year commitment? Obviously not all those 3 years, it's incremental, but at some point he develops it. I mean, COVID's not going away. Yeah. I mean, we're getting way better at it. Life's back going. Right. I mean, it's just going to fall into the flow of things. Hopefully we don't, get crazy about it every other time. But he could or another person could end up with it before the 3 years is over.
Sure.
Is that taken into account?
Yes, it is. And the statisticians help us with that and the control and the analysis itself. And the question would be, and to use your example, so we would go to Mike and say, okay, what changed? Did somebody in your home get sick and they brought it home? Had you had some new illness that changed your underlying immune system? Was there some reason not? Or he just says, nope, I'm just going about my life, and a year and a half into the study, I turned up with COVID. As you point out, COVID is going to become like the flu. There will be whether that's in 2022, most people think it's going to be more like in 2023, where there will be a COVID season just like there's a flu season, and they'll probably overlap. So the idea that COVID is going to go away in these people enrolled in this study is, as you're pointing out, not correct. And we're already accounting for that. We'll control for that. But the big question that will be asked, okay, we had the advantage of studying Mike for 2 years. He got it at the end of 2 years. Did it go away in 2 weeks? Or did it persist?
Well, we're going to persist with Dr. Marshall for a little bit longer. Coming up next here on Good, wrapping things up with Dr. Marshall today on his research at UMMC on long COVID. Many of you have started texting in to the C Spire text line, which I think is good because these are the questions you should be asking, and these are the questions that they would be asking you if you chose to be part of this. I think it's really important, too, Dr. Marshall, we don't overlook the fact they came to Mississippi for this research to be housed and done. I know it's in conjunction with other sites across the United States, but they put Mississippi on the list for a reason, and we should step up and do our part to be a part of it. I mean, it's history making, right? I mean,
I believe so. It's very innovative, and it's not only going to apply for the current pandemic, but for the future ones that are coming down the line, so that we can hopefully minimize the loss of life compared to what happened this time around.
And be better prepared.
Absolutely.
And so if we want to be part of it, how do we do that, Dr. Marshall?
So if you're interested in just finding out about it, and please, if you are interested, have a low threshold. Call us, and we can tell you, no, I'm sorry, you wouldn't qualify. The basic thing is you have to be 18 or older. It gets pretty soft after that in terms of other requirements. But our number is 601-815-3464, 815-3464. If the person that's there, they're there during the day, obviously, but they leave, you can leave a voicemail, and they'll call you back the next morning to set up a schedule to give you the information you want. And if you're interested, then we'll make an appointment. You'll come up to UMMC. We have parking vouchers for you, and it's up on the top floor of the main hospital. They'll give you all the directions. You'll be appropriately screened, and if you fit and you're interested and want to volunteer, you sign an informed consent document. We'll enroll you in the study and get you started. And there's nothing, a male, female, I don't care about your race, I don't care about your gender, I don't care about your age, as long as it's over 18. And whatever other illness you have. And if you say, I wonder if I have it or not, if I find out that you don't, it doesn't mean that we don't enroll you. We want to get people that don't have it as controls. If you say, I wonder if I might have had it because in April of 2020, I really felt bad, I got sick and so on. By the time they tested me, I was negative. Did I have it or not? There are ways for us to find out if you did, and we can put you in the appropriate category.
Someone said, I haven't heard the whole show, but that's okay. We forgive you. And it sounds like there's several symptoms that fit for my wife. She's 70 in pretty good health, but falls asleep watching TV, trouble sleeping, has not had COVID that we know of. I had it in January, but she had no symptoms. And he goes on to sort of say, and so it feels like, there could, and I think that's what I want to get across is this could be you, and it could be your loved one, and there's not necessarily a magic cure for it, but you could be part of at least figuring it out. And sometimes just being validated that you're not crazy is what you need.
Yeah, in the negative category so far, and people we're enrolling, it looks like between 10 and 15% of the individuals have evidence that they had COVID and never knew it. And it might have been a false negative in a test, or that they were never tested. So if someone's like that and they're interested, again, we're more than happy to screen them and try to enroll them so we could find out. Maybe they're a negative control that have trouble sleeping now for a different reason, or maybe it's related to COVID. That's part of the questions we're asking.
Say that number one more time, because
Yes.
He stopped to take notes.
It's 601-815-3464, 815-3464. Once again, 815-3464. 888-888-8264.
And I'll keep that number too if folks want to contact, and I can text it out because I think, Mississippi, again, I think we should show up, just be a part of it, help science out in this way. We don't want this to ever happen again.
Right.
And who knows, you may figure out your symptoms and get some relief. I think if you fit this bill, you've felt crazy for the last year or year and a half, and here's some validation that it's not everybody.
Right.
And it's not going to be everybody, but if you do fit this small subset of individual, then here's some hope to sort of figure things out, or at least start the process.
Well, not only start the process, the NIH will come out with opportunities for new treatment trials later on this year, I believe, certainly later on this year. And people that are already characterized that will be categorized to be put into these different trials, being involved with studies like this will make them one step ahead, if you will, because now there's already a level of characterization. And so they'll be able to say, well, for your trial, you're looking for people that have trouble sleeping or that have trouble thinking straight or that have breathing difficulties and they had COVID. Well, they've already been characterized. They've already been enrolled in the what we call the phenotyping study to understand them better. So that information's already there. And when they can say that for the therapeutic trials, I know as a clinical scientist, that type of person would be of more interest to me because they already know they're going to fit into the trial and trying to figure out whether they're going to. So that's a little bit of a plug for our study, but it is an added benefit that could be there for someone. Many of these people are just desperate, and they are even though they are dealing with it every day, they do anything to try to help get better. And that's ultimately where we're trying to go with this. The more we can understand, the quicker we can help them get better.
And that is a good thing. And we will be following this study here because I'm very interested in the outcomes. But you got more coming up next with Sports Talk Mississippi from 3 to 6. Rhino and I will be back tomorrow at 2. But until then, I hope you all find time for the good things.